Clomid Tablets. Clomid contains clomiphene, also known as clomiphene. Clomifene is a nonsteroidal triphenylphthalate derivative that acts as a selective estrogen receptor modulator SERM. Regulation. Clomifene is included on the World Anti-Doping Agency list of illegal doping agents in sports. It is listed because it is an anti-estrogenic substance. Clomifene was approved for medical use in the United States in 1967. Indication of Clomid: 1. Female infertility due to oligomenorrhea menstrual cycle greater than 35 days. 2. Secondary amenorrhea, absence of menstrual cycles associated with polycystic ovarian disease. 3. Male infertility. Contraindications. This medication is contraindicated in patients with liver dysfunction, large ovarian cyst, endometrial carcinoma, cancer in the lining of endometrium, uterine bleeding, bleeding from uterus, uncontrolled thyroid dysfunction. Clomid use in pregnancy and breastfeeding. This medication is contraindicated in pregnancy. Consult your doctor before use. This medication is contraindicated or not recommended in lactating females. Consult your doctor before. Side effects of Clomid: ovarian hyperstimulation, hot flushes, abdominal discomfort, visual discomfort, insomnia, inability to sleep, breast tenderness, headache, intermenstrual spotting, menorrhagia, heavy menstrual cilces, weight gain, rashes, dizziness, hair loss, ovarian enlargement, upset. When to have sex. To get pregnant when taking Clomid, you need to have sexual intercourse when you are most fertile. This will be the few days just before ovulation. The fertile window varies slightly from person to person, but most people with ovaries ovulate 7 to 10 days after the last Clomid pill was taken. This means you are most likely to ovulate somewhere between days 14 and 19 of your cycle. To ensure you have sex during your most fertile time, which is the 2 to 3 days before you ovulate, you may want to consider having sex every other day starting on day 11 and ending on day 21. Dosage of Clomid tablets. For females, 1 pill to be taken daily for 5 days, starting on day 4 or 5 of menstrual cycle. For males, 1 pill to be taken for 90 days with a break of 5 days after every 25 days.